thank you again for joining me. I thought it'd be really interesting for you to just start by kind of introducing yourself and also to explain or talk about how you discovered lipedema in your career.
Sure. My name is Iakovos Georgiou. I'm a consultant for plastic surgery. Up until about 9 months ago, I was working in Germany. For family reasons, I moved back to Cyprus quite recently, and I've accepted the position of head of plastic surgery at the German Medical Institute. We're changing our
Congratulations.
name right now, so yeah, we're rebranding. It will be official in a couple of weeks, but I think I'm going to start naming it that way so that I get used to it.
Yeah.
So the center where I'm working right now is quite new. They started building it around 2016, 2017. Right now it's expanding at a very rapid rate. They went from a personnel of about 50 to over 500 in like a year or so. So it's quite a big project. It's located in Limassol in Cyprus. It's between Larnaca and Paphos. So it's quite easily accessible with both airports in Cyprus.
Oh, great.
And so, yeah, we started with treating lipedema a few weeks ago here at the center. In regards to how I found out about the disease, I think it's probably something that you hear quite often when I'm remembering my medical student days. I can't really say that we were taught anything about lipedema, which is of course a shame, thinking about the prevalence, the incidence that we have with lipedema. So I think maybe I saw the word lipedema when I was studying medicine just once or twice, and I wasn't really paying any attention to it, not from my point of view, just from the professor. I started coming into contact with lipedema, I think once I came into plastic surgery, which was about 8 years ago, I would say. So that was the first time that I really had contact with lipedema patients. But I would say in regards to the treatment about lipedema, it was about 7 years ago when I really started, when I got in contact with Professor Gotz, and I think about 70% of the cases that I was dealing with in my last days in Bad Belzig and in Potsdam was about lipedema. So that became one of the areas of my primary focus, let's say.
Yeah.
Where I spend most of the day treating most patients.
Yeah, that's great. It's good that you found it, obviously, because we're glad to have you treating us. um,
Thank you.
yeah, and I also wondered like why, because I know you're a plastic surgeon, but why you were interested in like continuing to treat lipedema. What is it about lipedema that interests you?
I think the answer is getting a bit, I would say, cliche almost between plastic surgeons, because I'm discussing it with many colleagues and almost everyone gives the same answer. Basically, it's very rare that in a surgical specialty you find a disease with a treatment with the patients being so appreciative and so happy afterwards, almost immediately, because the lipedema patients, at least from my experience, have been going through many years of misdiagnosis or even without any form of diagnosis, without proper treatment. And when they do finally reach the proper diagnosis and the proper treatment, they're really extremely, extremely thankful for that. So I think that's the main reason.
Yeah, obviously from experience, I completely understand that. And I suppose it's not for me, it wasn't necessarily from an aesthetic point of view. It was more like kind of obviously there's the recovery, but kind of instantly you've got more mobility, and it's the heaviness that I notice pretty much straight away. Even with swelling, it's like a different feeling.
It's quite typical what you're describing. It's not the aesthetic part, at least from the first surgery, but the functional part. I remember the patient I had last week. I remember we took off the compression the first day after surgery, and the first thing she said, "I can't believe I'm seeing my knee." So it's very.
I know, and I suppose it's something that I still talk about. I can see a muscle on the front of my shin. I've never, ever, ever had that.
Yeah.
Even as a child, never had it. And I still talk about it because it's just like a bit of a novelty, really. We focus so much on wanting to look normal, and have a normal body
Mm.
to the point of being able to see your kneecap or your shin. It's not necessarily you want a gorgeous hourglass figure, it's just these normal body parts that
Yeah.
yeah. So I did ask my Instagram followers some questions, so I thought we could just go through those as
Mhm.
well. The first question was, are there any COVID restrictions at your centre currently?
So in regards to the center where I'm working from, I mean, always the nomenclature is a bit of an issue, especially when we're dealing with UK patients who had the same issue back in Germany. We say clinic in Germany, but it's a different definition back in UK. So even though I was working in a clinic officially, as it's called in German, it's still like a fully functioning hospital. It's pretty much the same here as well. So it's brand new center with, we have 7 surgical theaters, if I'm not mistaken. The first surgeries took place in beginning of this year. Everything's quite state of the art. We have a fully functioning ICU as well, which is always important
That's amazing,
when you're
yeah.
dealing with large volume liposuction.
Yeah.
Yeah, safety above all else. We do not currently have any COVID restrictions, just the fact that before surgery, before admitting you into the hospital, we would need to do a rapid test, basically. That's it.
Okay, I say that's quite a standard at the minute now, isn't it? I suppose we're just getting used
Yeah,
to living with
that is.
COVID. So another question was, do you have a BMI limit?
We do not have a BMI limit. What I like to do is with each case, we have a brilliant team of anesthesiology here. So I like to, before a patient comes from abroad, I like to collect all the necessary examinations. So we want to take like all examinations possible to be sure that we do not have any last minute postponements once you arrive. And basically you arrive one day at least before surgery so that we have the formalities before surgery. And that's it. So no BMI limit, no weight limit.
I'm so happy to hear that. Just because I know obviously you've worked with Dr. Gods and I know
Yeah,
it's a big barrier for people. It was a barrier for me that the irony is of lipedema, you've
yeah.
got excess weight, but a lot of doctors don't want to treat you because of your BMI. So it's like, it's great to know that there are people that will treat people.
I think now everyone knows that BMI is not definitely not the best tool to discuss in lipedema patients. I think what the problem is with other colleagues that they have this BMI limit is, at least most of the cases, they're not working from a fully functioning hospital, so they do not have an ICU, so they have this limitation. I don't have this issue here. And that was one of the prerequisites when I came here. This is the reason basically I came here, is because I I didn't find any other centers in Cyprus that could offer the safety level that the German medicine offers me.
And obviously, you've spoken that you're a plastic surgeon, so you can do like skin removals and all those things alongside lipedema surgery. So that's useful for people.
So always we start with the conservative treatment, like we're starting to wear the proper compression garments. Some cases we also do MLD, and depending on the stage, then we discuss with the patient how many rounds of liposuction are needed. Then once we're done with the liposuction, we wait a few months to see how much of the skin will retract by itself. And then we decide if we should go forward with the skin excision surgery, a thigh lift. So another thing that I do offer here, we do vaser liposuction. So it's not just power-assisted liposuction that we do. We also do vaser, which is a form of ultrasound liposuction in selected cases, and which does offer a bit more of skin retraction. I also have some other equipment that I can use to promote skin retraction. So it's decided on a case-to-case decision, let's say, depending on the patient.
That does lead on to kind of to a question. Somebody asked, do you do abdominal liposuction with a tummy tuck? Because many
Yeah,
surgeons don't.
yeah,
So you do them both at
yeah,
the same
I do.
time.
I do.
Bro.
Yes, of course. I mean, you can't. I assume they mean liposuction of the abdominal area. I mean,
Yes.
combining abdomen liposuction. Yeah. So yeah, of course. I mean, that's pretty much standard nowadays, and I mean, you just have to be careful of the areas you're doing the liposuctions because of the blood supply of the abdominal wall. Combine the liposuction with the tummy tuck.
Somebody asked, what is your surgical approach and why do you think it's the most effective?
So I come from Dr. Gott's schools, so I've been trained with Dr. Gott. So through my training with him and seeing with him and his treatment really works, is that we have to be quite aggressive because the hypothesis is that it's altered in some way and it does cause some symptoms, the symptoms of pain and heaviness and tenderness and the bruising. So we are always bound by the 8 to 10% rule, which means I cannot remove more than 10% of your total body weight in lipoaspirate during each surgery. That's why very often it's a multi-stage treatment. It means having more than one liposuction procedures. So if I would describe my technique, it would be a multi-stage functional liposuction, combining power-assisted liposuction with vaser in selected cases. And I do that until all the symptoms are either alleviated or very.
So another question, they were asking if you have any tips to maintain results post-operative.
Yeah, it's a very important question, very important topic. So what many plastic surgeons are saying, many colleagues that have experience with lipedema is something that unfortunately, once you have the diagnosis, is something that you will live with for your life. So what we do is not a curative treatment. It's a symptomatic treatment. We're decreasing the symptoms. So the best option is always to be aware of the fact that in some cases we do achieve compression garments after surgery, but it's not always a guarantee. So it's important as part of the informed consent to tell the patient there are cases, for example, if you're going on a long flight, if you're going on a hike, it might be a good idea to wear your compression garments to avoid excessive swelling. That's one issue, the compression garment. The second issue is always a good idea to implementing in your lifestyle some form of movement, either taking long walks, hydrotherapy, exercising, whatever works best for you. Another idea is always to be as careful as possible with the healthy nutrition. It's also a good idea to try and maintain the weight after surgery. Of course, we're not talking about any radical diets. We're very much against that. Mm-hmm. It's a difference between healthy diet, healthy nutrition, and a radical diet that I know a lot of lipedema patients put themselves through simply because of the fact that they're fed up that they've been, or even recommended from colleagues that do not know about lipedema. So I'm not talking about that. I'm just talking about healthy nutrition, proper exercise, and proper movement to try to avoid excessive weight gain.
Yeah.
So these are the most important aspects to maintaining the effect of surgery. Maybe that's also one of the areas that we're a bit behind on the proper education of nutritionists on lipedema. At least here in Cyprus, I have like 3 nutritionists that I know have a good concept when it comes to lipedema patients, because as you said, radical dieting could be quite detrimental, not only from the physical aspect, but also on the mental aspect. And a lot of patients really struggle with that, and it doesn't really help going on an extreme dieting, especially before surgery, as you said. You're a great example of that, actually.
Yeah. No, and it's good to hear doctors consider the mental health aspect as well, because I don't know what it's like in Cyprus, but in the UK, you'll visit your GP, your doctor, and they're diet obsessed. They just see a big person and you need to cut your calories, you need to do this. But it's good to have doctors like yourself who actually understand it's not that simple and it really does impact us mentally.
Yeah, very true.
Yeah. Another question was, what would you do for a patient who didn't get the desired results regarding pain and aesthetics?
It's again a patient-to-patient selection of how you go forward with this. So if it wasn't my patient, so if it was from another doctor, I would definitely like to see the surgical report to better understand the procedure that was used, because quite often I get a lot of patients that have been with a plastic surgeon for liposuction and they didn't have the results that they wanted. And the issue was almost always that the plastic surgeon didn't have any experience in lipedema liposuction, which is like a functional liposuction is very different to an aesthetic liposuction. Many different things that you have to take into consideration. So that would be the first step that I would do. In case that I see the report and I see that it wasn't the technique that I'm using, and I could still feel that the patient had like either regrowth or fat that was never properly be removed, then I would maybe discuss the option of doing another liposuction, like a touch-up or revision liposuction. If I examine the patient and I see that there's absolutely no fat to be removed, and for whatever reason, maybe there was some damage to the lymphatic tissue, lymphedema that was either masked before the liposuction and was never seen, or even due to not a properly performed liposuction was induced because of the procedure. So I think that would be the best, the two things that I would be thinking about, doing a revision liposuction just to be sure that all of the lipedema fat was removed. And if that wouldn't be the case, then I would always consider a lymphedema component. If I do see that that's the issue, then the best option is proper conservative treatment, like proper compression therapy, in some cases even class 3. So once I do this and I see that there is an improvement and I confirm the diagnosis of lymphedema, then there is the prospect of doing lymphatic microsurgery. But that's another direction, another much more complicated procedure, and it's really, really rare. I personally have never seen a lipedema patient that has developed afterwards lymphedema due to liposuction, but theoretically it is possible and something that we do need to keep in the back of our mind.
So somebody asked, if they're travelling from abroad, how long would you want them to stay in Cyprus for post-op?
It also depends on the age of the patient, the stage of the patient, how many liters I'm expecting to remove. Generally, a good rule of thumb would be at least 7 days after the surgery, you would be able to fly back home. But as I said, it depends on how far you're flying, how many liters are removed, so many factors. So definitely always a good idea to have like a consultation with each patient to discuss that beforehand.
Brilliant. And for your consultations, if there's any cost for a consultation, for the initial consultation, and do you offer them over Zoom, Teams for people that are abroad?
So there's no consultation fee. There's no cost for the first consultation. It's always a good idea to send me photos of the areas that are affected beforehand. And I also have like a questionnaire that I like the patients to fill out so that I can prepare better for the consultation. And during the consultation, usually over Zoom, we go through all the questions that the patient might have.
So I've got a couple. Well, one last question from a follower was, do you see any common traits with lipedema patients that isn't discussed or seen as a common trait? So I guess it's just if there's anything you've spotted that is common, but maybe we don't know it as common. I think that's what they mean.
Lipedema is currently I would say right now it's currently a hot topic, and that's a good thing. There's a lot of colleagues currently involved in research in that. So I think even the symptoms that we were discussing like a couple of years ago that they weren't very well described in publications, right now are getting a lot of attention, which is important. I think maybe one thing that I had a couple of patients I was discussing with that specific patient from Canada a couple of weeks ago was she was afraid she's perimenopausal, so she will be starting hormonal replacement therapy. And she was also mentioning that in a lot of forums there have been patients that after going through the symptoms of menopause and starting hormonal replacement therapy, they have had some regrowth of the lipedema or even a flare-up of the lipedema symptoms. So I guess that is still lacking a bit in the guidelines. Not a lot of gynecologists know how to deal with that. They don't even discuss the issues with the patients before going starting patients on hormonal replacement therapy. So I think if I would find one area that maybe is not as well described, it would be this one.
Yeah, I think that's true. I personally don't know much about the menopause anyway, so with it having an effect on lipedema, I've got no idea. And I suppose it's one of those
Yeah.
things at the minute where people are having to experience it to learn about it, and hopefully soon we'll know more about it. But yeah, that's great. Thank you. That's been so interesting. I suppose one little question I thought we could add on the end is for you to give us one reason why we should come to Cyprus for surgery. What makes Cyprus special?
So, one reason. I mean, I think the level of care that we can offer here at the center is quite high, I would say. That's always the most important factor. Other reasons will also be that, I mean, Cyprus is a lovely place to visit. I know a lot of patients coming from the UK, and many of them that have contacted me already have mentioned that they either have family or friends living here, so they can combine a visit with them with the staying part, or even stay at their place if it's near the center. So I think that would be the main guiding factors.
Yeah, no, I really hope one day we can come and visit. We've been looking at holidays for next year and trying to nudge Leon to Cyprus area, so we'll see. But definitely soon. But yes, thank you for that. Is there
uh,
anything you wanted to add?
no problem. No, thank you for thinking of the idea of having like a short video call together. I mean, well, if you do decide to visit Cyprus, I would love to show you around because
Yeah, that'd
it's
be
always
great.
a good idea. Because you have also a lot of contact with doctors now. So I would love to scratch your head as well. Maybe you can give me like a couple of tips of what we can improve, which is always a good idea. And apart from that, if any patient has any questions, even if they want to email me anonymously, they can do so. Whatever they feel more comfortable with.
Brill. And I'll link your um, email address in the description on the YouTube channel.
Through the website, there's a contact form that patients can contact me directly. So that might be the easiest option.
Brill. Yeah, that's perfect. So, thank you again. Really useful. It's great to hear that you don't have a BMI limit. I think that's a really big part of the surgery that's lacking. So, fingers crossed, everybody will be flying over Cyprus soon. And yeah, thanks again for your time. I really appreciate it. See you soon.
Thank you. Bye bye.
Bye. Bye.